day one, I would bring to Parliament a proposal for a legal cap on migration.
And what would that be? That
would be the tens of thousands or lower.
OK, so not 100,000, you're saying lower than 100,000.
Lower than 100,000.
And what if people in the healthcare sector or in hospitality said, don't be ridiculous, we haven't got enough NHS doctors and nurses, we don't have enough chefs to staff the kitchens of our pubs, we actually don't have enough homegrown talent to do some of the front service jobs that the immigrants come in to fill because we can't get our own people to do them?
I don't pretend that ending mass migration will be plain sailing, but I do think it's in the national interest to do it. I think it has to be linked to welfare reform. I believe in a safety net, but I think far too many people are on welfare, and we need to help our own people back into the dignity of work, get those people working in those sectors.
Would you have a healthcare exemption, for instance? What about social care?
No,
most nursing
I
homes
wouldn't.
are staffed by overseas employees.
That's not correct. 8 out of 10 people working in social care are British people.
OK.
And what we've seen in recent years is that because we haven't been prepared to pay British workers a bit more, we're bringing in people from overseas, displacing those British workers.
Do you think care homes can afford to pay more when they've already been crippled by COVID and are closing down in their droves?
Well, I think we should be paying more through the taxpayer, because it's a false economy to, instead of paying a British person a bit more to be doing that difficult job, we're bringing in somebody from overseas, often with their family, who then need to be housed, education, the health service. The cost to the taxpayer is greater by doing that. So it's a very short-termist approach we've had in recent years.
That's a cogent policy on legal immigration, and thank you for your clarity on that.